What if the way your brain processes information is different from those around you? Imagine living in a world where the rules seem to be written in a language you don't understand. That's a day in the life of someone living with a neurodevelopmental disorder. These are conditions that affect the development of the brain, altering the way it processes and interprets information. It's not about being less, it's about being different. Today we delve into the world of two such disorders, autism spectrum disorder and intellectual disability. Imagine a spectrum of colors, now envision a spectrum of human behaviors. This is autism spectrum disorder. Autism spectrum disorder, often referred to as ASD, is a neurodevelopmental condition that affects how individuals interact with the world around them. It's like a unique color palette of behaviors and experiences, with each person exhibiting a different blend of traits. One of the key characteristics of ASD is challenges with social interactions. This could mean difficulty understanding and interpreting other people's feelings or perspectives, or struggling with the give and take of conversation. It's not that individuals with ASD don't want to connect with others, but rather they may not know how, or they may do so in ways that are unique to them. Alongside social challenges, people with ASD often demonstrate repetitive behaviors. These can take many forms, from repeating specific phrases to following rigid routines. For some, these repetitive behaviors can be comforting, providing a sense of order in a world that can often feel unpredictable. Then there's the realm of speech and nonverbal communication. Some individuals with ASD might speak in a monotone or unusually fast pace, while others might not speak at all. Nonverbal communication can also be a challenge. Understanding gestures, making eye contact, or using facial expressions can be difficult for those on the spectrum. But let's not forget, ASD isn't defined solely by challenges. People on the autism spectrum often have unique strengths too. Some may have exceptional attention to detail, others may possess strong visual and spatial skills, and many have a deep, intense focus on their interests. Just as each color on a spectrum has its own distinct hue and brightness, every individual with ASD has a unique blend of strengths and challenges. There's no one-size-fits-all when it comes to ASD. Each person's experience is as unique as their fingerprints. Recognizing and understanding these diverse characteristics is crucial, not just for those with ASD, but for everyone. It helps us foster acceptance, promote inclusivity, and better support those on the spectrum. Indeed, autism spectrum disorder is as diverse as a rainbow. Autism spectrum disorder, a mystery to scientists for years. What causes it? For a long time, the origins of autism spectrum disorder, or ASD, remained shrouded in mystery. Today, we are starting to unravel the complex tapestry of factors that contribute to its development. The first major factor lies in our genes. Our genetic makeup plays a crucial role in our neurological development, and certain genetic mutations have been linked to ASD. These mutations may be inherited, or they could occur spontaneously, known as de novo mutations. However, genetics is only one piece of the puzzle. Environmental influences also play a role. For instance, exposure to certain harmful substances during pregnancy, such as alcohol or drugs, can increase the likelihood of ASD in the child. Even factors like advanced parental age at the time of conception have been associated with a higher risk of autism. It's important to note, though, that these are potential causes. They don't guarantee that a person will develop ASD, and in many cases, ASD occurs in individuals without any known genetic mutations or specific environmental risk factors. In essence, ASD is likely caused by a combination of genetic and environmental factors, interacting in ways that we are still striving to understand. While the exact causes remain unknown, research continues to unlock the mysteries of autism spectrum disorder. Now imagine a different scenario where understanding concepts and learning new skills is a constant struggle. This is intellectual disability. Intellectual disability, often referred to as ID, is a term used to describe a condition where an individual has certain limitations in mental functioning. These limitations can lead to difficulties with skills needed for daily life, such as communicating, taking care of oneself, and socializing. It's not about being a little slower to learn or about being a bit behind in school. It's a lifelong condition that affects the way a person understands, processes, and responds to the world around them. This condition, which was previously referred to as mental retardation, is characterized by an IQ score that is considerably lower than the average. Specifically, an IQ of 70 or below is a common indicator. However, It's important to note that intellectual disability is not just about numbers. It's about the impact on the person's life and their ability to function independently. People with intellectual disability might take longer to learn to speak, may have trouble remembering things, may not understand how to pay for things, or how to get from one place to another. They could also struggle with understanding social rules, which can make interactions and building relationships quite challenging. But it's key to remember that every person with intellectual disability is unique. The challenges they face and the support they need can vary widely. Some might need help with nearly every aspect of their daily lives, while others might only need assistance with tasks that require complex thinking or planning. And while it's true that intellectual disability can pose significant challenges, it's also true that with the right support, individuals with this condition can lead fulfilling lives. They can learn, they can work, they can form relationships, and they can contribute to their communities. Intellectual disability is not a disease, but a condition that affects learning abilities. It's about understanding that these individuals may learn differently, and that's okay. They have the same rights and deserve the same respect as anyone else. It's about recognizing their potential and supporting them in reaching it every step of the way. What causes intellectual disability? Is it genetics, environment, or both? You might be asking yourself these questions, and the answer is yes, all of these factors can contribute to the development of intellectual disability. First off, let's delve into genetic conditions. Certain genetic conditions, such as Down syndrome and Fragile X syndrome, can cause intellectual disability. These conditions are often present at birth and can affect a person's physical, intellectual, and developmental abilities. Next, we consider problems during pregnancy and childbirth. Factors like alcohol or drug use during pregnancy, a lack of oxygen during childbirth, or premature birth can all lead to intellectual disability. These are critical periods in the development of a child's brain, and disruptions can have long-lasting effects. Illnesses or injuries, particularly those that occur in early childhood, can also lead to intellectual disability. Infections like meningitis or whooping cough, severe head injuries, or exposure to toxic substances like lead can all cause damage to a child's developing brain. Finally, certain environmental factors can contribute to intellectual disability. These can be things like malnutrition, exposure to harmful environmental toxins, or even severe neglect or abuse. As you can see, the causes of intellectual disability are not one size fits all. They are complex and multifaceted, often involving a combination of genetic, environmental, and health-related factors. The causes of intellectual disability are as diverse as the individuals it affects. While there's no cure for these disorders, there are ways to manage them. So what are they? When it comes to autism spectrum disorder and intellectual disability, the treatment approach is often multifaceted, encompassing a variety of therapies and interventions. Each person's treatment plan is tailored to their unique needs and goals, and it often involves a mix of behavioral therapy, speech therapy, physical therapy, and medication. Behavioral therapy is a cornerstone of treatment for both autism spectrum disorder and intellectual disability. This type of therapy helps individuals learn how to navigate social situations, manage emotions, and develop essential life skills. It can take various forms, from applied behavior analysis, which uses positive reinforcement to encourage desired behaviors, to cognitive behavioral therapy, which teaches individuals how to manage and change unhelpful thought patterns. Speech therapy is another crucial aspect of treatment, particularly for those with autism spectrum disorder. It helps individuals improve their communication skills, enabling them to express their needs and feelings more effectively. Physical therapy can also play a significant role, especially for those who have motor skill challenges. It helps improve coordination, balance, and strength, enhancing overall physical functioning and independence. Medication may also be a part of the treatment plan, but it's not a one-size-fits-all solution. It can help manage specific symptoms, such as attention problems or anxiety, but it should always be used in conjunction with other therapies, not as a standalone treatment. But the key to all these treatments? Early intervention. The earlier these disorders are identified and addressed, the better the outcomes tend to be. Early intervention programs can help children develop vital skills, improve their functionality, and enhance their quality of life. So, while there's no magic pill or quick fix for autism spectrum disorder and intellectual disability, a comprehensive early intervention treatment plan can make a world of difference. It's all about equipping individuals with the tools and support they need to thrive. With the right support and resources, individuals with these disorders can lead fulfilling lives. In the past 10 minutes, we've journeyed into the world of autism spectrum disorder and intellectual disability. We've unraveled their complexities, delved into their causes, and understood the treatments available. We've seen how these disorders are not boundaries, but rather unique ways of experiencing the world. It's crucial to remember that knowledge is power. The more we know, the better we can support those who navigate life differently. Remember, understanding these disorders is the first step towards acceptance and support.